A woman will always remember how she felt when she gave birth. This is true for me as well. However, some of the events surrounding the birth of my second child are not very pleasant. My obstetrician offered me an elective C-section, and after hearing how safe it was and how it's done all the time, I agreed. But several complications occurred during my C-section. My spinal block didn't work as well as it should have, and I felt a lot of pain during the surgery. Also during the surgery, my baby's skin right here under her ear was lacerated when the doctor was opening my uterus, and she still has a scar there. I also lost a lot of blood and came very close to needing a blood transfusion. My experience was a far cry from how easy my doctor made it out to be. Now I know that not every woman has complications, but after my recovery I felt compelled to do some research about medical intervention during childbirth. What I found was shocking, and there are some things that everyone should know about childbirth. Today I will discuss some of the ways that the medicalization of childbirth has hindered it rather than improved it. First, we'll look at the C-section rates in the United States compared to the rest of the world. And second, we'll look at the number of births performed by obstetricians as opposed to midwives. And third, we'll look at how some common drugs used for labor and pain relief can have dangerous side effects and actually work against each other. Let's first look at the rate of C-sections in the United States. In the April 2008 edition of Fit Pregnancy magazine, it says that the C-section rate in the United States is more than twice that recommended by the World Health Organization. The World Health Organization recommends no more than 15%. The U.S. is more than 30%. Women are being given C-sections for non-medical reasons, such as scheduling time off of work, convenience, and even fear of labor. It's important to note that a C-section is major surgery and it's not free of risks or complications. Here is a list of possible risks of a C-section: infection, increased blood loss, decreased bowel function, reactions to anesthesia, risks of needing additional surgery, rupturing the scar during another pregnancy, and needing C-sections for additional births. A C-section also leaves a very large scar across the abdomen. Next, let's look at the number of deliveries performed by midwives. Midwives have delivered the majority of births for centuries, and that still remains true for most of the world except for the United States. According to the World Health Organization, 70% of the deliveries in Europe and Japan are performed by midwives. These regions also have some of the lowest rates of maternity deaths and infant deaths. The World Health Organization says that the U.S. has only 8% of deliveries performed by midwives. And the U.S. is one of the highest in terms of maternity death rates, and it ranks second for newborn deaths. Finally, let's examine some problems with common drugs used for labor and pain relief. Pitocin is a drug used to induce labor. According to the New England Journal of Medicine, most studies link inducing labor to increased use of C-section deliveries. Dr. Robert Caldrea Barcia, who is the former president of the International Federation of Obstetricians and Gynecologists, stated that Pitocin is the most abused drug in the world, and a startling 81% of women in U.S. hospitals receive Pitocin. An article in the April 2001 edition of Mothering magazine states that research even suggests that the exposure to Pitocin may be a factor in causing autism. Here is a very long list of the possible side effects and risks of Pitocin that came off of the drug label. According to an article in the November 2005 edition of Mothering magazine, several negative side effects can occur when an epidural is administered. Side effects to the mother can include slower, longer labor, decreased blood pressure, and increased temperature. Rare but serious side effects can include convulsions, long-term nerve damage, and cardiac arrest. Side effects to the baby can be abnormal fetal heart rate and fetal distress. An epidural can also make pushing more difficult. If a mother is not able to push the baby out, then a C-section may be done, or the doctor may use vacuum extraction or forceps. For those of you who are not familiar with forceps, this is a picture of forceps, and this is how they are used to deliver a baby. Down here is a picture of a baby who is seriously injured by the use of forceps. Pitocin and an epidural are almost always used together. In addition to the side effects they produce separately, they can also work against each other. Many times this is the scenario. Pitocin is given to induce labor. Because the Pitocin causes more painful contractions that are closer together and longer, an epidural is given to ease the pain. But the side effect of an epidural is that it can slow the contractions and make them less productive. When this is seen to happen, more Pitocin is given. The Pitocin again causes more painful contractions, and then the epidural is increased. This can go back and forth several times in the process of labor. Meanwhile, the baby starts to feel the effects of all these medications. The longer, harder, closer together contractions can easily throw the baby into fetal distress. When this is seen, an emergency C-section is then needed and mom is rushed off to the operating room. Ironically, the doctor may say, "Thank goodness we were able to save the baby's life with a C-section." However, it's overlooked that none of these complications may not have occurred if we didn't intervene in the first place. In conclusion, I'd like to say that there is a time and a place for technology and medicine in childbirth emergencies. But we have to accept that a huge percentage of childbirth occurs without complications. When we start to interfere, it can easily be seen that one small intervention can easily lead to many more interventions that were originally not planned and not wanted. We have looked at the alarming rate of C-sections, the small rate of births performed by midwives, the complications of medications used for labor and pain relief. But birth is a natural process, but in this country it's treated like an illness that needs medication and surgery. At some point we have to say enough is enough. If we continue on this path, we will lose the process of birth at the way it's been happening for thousands of years.